So good afternoon all. I am Michelle Delacroix Blake. I am coming to you from St. Kitts and Nevis, and I am going to be the moderator for our 1 hour meeting here today. So I'm just going to start off by saying a couple of things. I see people have started introducing themselves in the chat, and we encourage people to do so that we could know who we have here with us this afternoon. This afternoon, we are pleased to have everyone here with us to have discussion on MHPSS and the way forward. Now, MHPSS, as we get started, you'll get a lot more insight into what it is, what we are doing. You'll hear acronyms like the COP, the Community of Practice, so you'll get a little bit of a sense of what that is. So today we are going to hear from you, as I say, in terms of introducing each other. We are going to introduce who we have here. So we have a team of persons here who have been working on the MHPSS forefront for quite a while. We have some of the persons from in the region. So you have, that is Dita, Emmanuel, you have Alicia, you have a few other people. You have Valeria and Anna, who are our technical folks and who really get keeping things running. And we have with us Marcio, who you will hear from when he gets his point in the program, when he describes what we're here doing. And it really is the meat of the matter. So Marcio will come to you a little later. Now, we have chat, as I said, and we want you to use the chat for introducing yourself, but for also asking questions, for making comments, for anything that you think is important for us to know here in this session. I will say that as we come close to the end of this session, Valeria is going to put some things in the chat that we want you to respond to, namely an exit survey. And you're gonna hear a little bit more about this as we go along, but we want people to connect to being a part of the MHPSS program and rollout. So we're gonna ask people to click on one of the links and see if there are things that you want to be associated with. And of course, there's going to be a link to the registration for the MHPSS material. So there are going to be some things in the link that we want you to attend to. And again, I'll say that as I come along. So as we go along, I'm going to go ahead and get started with letting you know how this is going to play out. We're going to have some presentations and some discussions. We're going to have discussion led by Zita, we're going to have a discussion led by Marcio, and we're going to have a discussion led by Alicia, and then we're going to wrap it all up. We hope that if there are some questions that you have that we're not able to answer or we're not able to get to in this hour, that you're able to, and I hope Valeria could perhaps post a link where you could perhaps send other questions that you may have, any concerns, anything you want to know a little bit more about, so that we could have ongoing contact. But at the end of this, we hope to be able to broaden our MHPSS footprint and the people who are on the ground doing the MHPSS work. We want to be able to have discussions and interactions with you. So I am going to go ahead and get started and ask Zita to come to the forefront and have some discussions with you, a little bit about what MHPS is, what Community of Practice is. She'll talk to you a little bit about that. She'll spend about 10 minutes doing that. So Zita, welcome.
Thank you very much, Michelle. Good afternoon, everyone. I'm so glad to be here. So as Michelle was saying, really, we have MHPSS. It's an acronym for Mental Health and Psychosocial Support. And in 2020, PAHO ran a training for 14 Caribbean countries. So representatives from 14 Caribbean countries did this training. And I think it went over maybe 5 or 6 months. But we continued to meet after that. And we continued to be supported by PAHO during the COVID-19 as we exercised our newfound skills in MHPSS coordination. So in 2022, we continued to meet. We grew much closer in terms of what we wanted to do in terms of a work plan. So we defined a work plan and we had leading persons assigned. So you're hearing from some of us today, myself, Michelle, Alicia, Trika, there are a number of us. And we've met 5 times over the year. So we've been learning from the experience of our colleagues in St. Kitts and Nevis, basically, and in Bahamas and Haiti. So we're talking climate change, we're talking hurricane season, how we've exercised our knowledge in MHPSS coordination. And, you know, in Haiti with the number of challenges, how you prioritize, how you coordinate, how you make sure that people get the support that they need. So at the end of 2022, we decided that we were going to formalize our Caribbean, or basically community of practice. And I think, you know, at some point you would be invited to help us come up with a name for this so that we have some ownership of it. But what we were able to identify as a team are the foundational pillars. So we have 3 of them. The first and the most important one is our companionship. You know, the way we've reunited with each other, the way we carefully listen to each other, and we give meaning to personal growth in the work that we do. So we understand each other, we respect each other, we share technical contributions. You know, we have a lot of complexities in the Caribbean region. We have similarities, but we have a lot of differences, and we celebrate those differences. You know, and we recognize the things that bind us together as one people. So we have a good awareness, and we think very critically, not only about the situations we face, but also things like the political landscape and how that impacts on what we do. But I think that the final pillar is really how committed we are to growing MHPSS in the Caribbean, and just build the resilience of the people, so that when disasters come, we can respond to them in a very effective way, but not just waiting for a disaster to come to respond, but to be able to be prepared. So learning from, you know, experiences of each other, building on that experience, so that we can prepare for anything that comes our way together, and we can support each other through that. So I think that gives you, hopefully it gives you a very good foundation of what our MHPSS in the Caribbean is all about, and you know what we're hoping to do with this community of practice. So I say thank you very much, and I turn back over to our chairperson for today.
All right, thank you very much, Zita. I mean, I think you eloquently and adequately described the work that we are doing so far. I mean, one of the things that I like that you talked about is the fact that MHPSS, the journey that we're on, isn't only just about responding to crises or to things that are happening just throughout the world or throughout our region. You're also talking about building resources and building networks and building so that we can have a sort of safe and inclusive place, certainly in the region. So thank you for giving that. That was a very comprehensive view. You took us back from the very beginnings of this, right through our relationships and how we have developed into a community, literally a community. And really what we are saying, and I think you hinted at it, we want more people to be a part of this community, because we ourselves are gaining so much and learning so much about ourselves in the region through this community. And we want to make sure that all of our other colleagues, or as many of our colleagues as possible, be a part of that. So thank you very much again for that, Vita. So now we are going to ask our leader, Marcio, to jump in here. Now, Marcio is someone who has been with us in this journey for the entire time that we've been journeying. And Marcio is someone who we have come to recognize as just rich with information. He just knows, he has experience, and he's so willing to hear from us in the region as we give our experiences when we have our meetings, and use his skill and knowledge to be able to sort of bring everything together. So Marcio is our guy that we see on a regular basis and who's been here with us for forever. Marcio is, he's going to tell you a little bit about himself, but he's going to talk to us about the introduction of the IASC MHPSS Coordination Handbook. And that's what we're here to really find out about. So it's a lot of acronyms, but IASC, for those who don't know, stands for the Interagency Standing Committee. I think that's right? And the MHPSS you just heard, Mental Health and Psychosocial Support. So Marcio, we are going to turn it over to you so you can just carry us through the handbook.
Thank you so much, Michelle. And thank you as well for you, Zita, for this so nice introduction, taking all of us to the history of this initiative, of this group, of what we are calling and identifying ourselves as a community of practice on mental health and psychosocial support for the Caribbean region. And I'm so glad that you have posted that statement, which is a statement not coming from books, but is a statement coming from the group that have been in the past 2 years working together. And it's a statement that kind of describe an ethos of relationship, of mutual support, and a vision that we have for this region when it comes to mental health and psychosocial support, which at the end of the day is about people, it's about alleviating suffering, but also preparing and building over their resilience. So this is very important, and especially today, this makes me this makes this meeting today even more, I would say, critical on my mind, because I had this meeting just before this meeting here on the Turkey and Syria earthquake response. So it was a global call on MHPSS for this emergency. I was part of this meeting, and how important it is to really have and build on and make this field of MHPSS develop more and more in a sustainable way. And I'm glad to see that this is happening in this region as well. And thanks for reminding that all these actually had a very important beginning, which was the PAHO course back in 2020, if I recall well. And it's when we start to systematize more better the work of MHPSS in the region. And today here we are. It's a national meeting where we are going to also present some ideas that the group has for this year. And it's very convenient that we had the launching of the coordination handbook just a few weeks ago, which I will be happy to be sharing with you how, just to introduce the handbook briefly, explaining you a bit the content of this handbook, and to reflect on how some core ideas of this handbook can actually serve the field, can actually serve your context in your country. It's a short introduction. It's not a course, but it's worth to mention that I was part of the core team writing this handbook, and I see here that many names that were part of the training back 2020 when we actually started the developing the coordination handbook. And some of you that are here can remember that I was mentioned during the course that we were about to finish a coordination handbook that would serve the field. And that was almost 2 years ago. So only now, after 2 years, we kind of had the launching of the coordination handbook. So with all that said, let me open here my presentation. In the meanwhile, feel free to write in the chat questions, comments. You are more than welcome to do that. I hope you do, actually, by the way. All right, so this is the handbook for mental health and psychosocial support coordination that was launched. We had the approval on 7th of December, and now it has been released, I think, about two weeks ago. I will be talking about 4 main points: why we have this handbook, how it was developed, by whom, and what's the content of this handbook. So just to mention, we have why the handbook is because mental health and psychosocial support is becoming a big movement across humanitarian emergencies and humanitarian responses. So MHPSS has become like a big agenda in the world. So it has, looking at the past where nobody would care about mental health and psychosocial support, now there is a very strong participation, collaboration, and what we call technical working groups around the globe doing MHPSS activities. It has been there has been also an important acknowledgement from governments, especially because of the COVID-19, on the MHPSS needs of the entire populations. And therefore, we have created this handbook as a way to guide some of this work based on good practice. No, I don't like the term best practice, because best seems like is on the top of things, but good practice that we can we have collected around the globe and shared through this handbook. There was a core development team which was part of IFRC and WHO on the global level, and myself. Plus, however, there was a long process of consultation through a desk review. So you can see here, there a desk review that started back in 2020. We are not, the MHPSS field is not the first field to develop a coordination handbook. We have health coordination handbook, we have protection coordination handbook, we have nutrition coordination handbook, and therefore we kind of try to learn from other sectors to understand what they have been doing and how useful it was, the handbooks that they have created. After that, we had an extensive process of consultation to develop the handbook, consultations with co-chairs of technical working groups, consultations with technical working groups, and even Trinidad and Tobago here has been one of the technical working groups around the world that we have consulted to learn and to see what they think from their perspective could be useful to have in this handbook. A guiding roadmap for developing this handbook for us was learning from other areas, having a deep listening from the field, but with a critical thinking as well, with a critical learning of the process. There was never an expectation to standardize the field. It's important to say that, to not misuse this handbook. We emphasized the 2007 guidelines, MHPSS guidelines. And a core and central aspect of this handbook is that coordination is not by the power of decision. Coordination is a result of a very good collaboration. And that's what we stress out over the whole handbook. In order to understand the handbook or to be able to navigate the coordination handbook, it's important to, first of all, have the core knowledge of the guidelines, of the MHPSS guidelines. So I will not be explaining these, but basically without the guidelines and the understanding of the core elements of the guidelines, such as the pyramid of services and needs, it will be difficult to kind of navigate to the coordination handbook. So we already assume that people that will get through the coordination handbook will actually have this pre-knowledge of the framework we use for mental health and sexual support in humanitarian settings. So coming out to what is the handbook, basically the handbook is, we have a part where we talk about governance of technical working groups. What is the different types of coordination mechanisms for mental health and psychosocial support? So because there is not one size fits all, right? There is not one model for everywhere. There are different models of collaboration structures among partners that leads to a good coordination process. You also have different types of emergencies where it's more related to what we call cluster systems, meaning when there is a whole structure from the United Nations that comes to the ground and push and put there in place the cluster mechanisms. Then you have a context where it's a public health emergency like COVID-19, so the coordination mechanism is a different one. So I think we were careful to describe some of those common coordination structures and explain some core aspects of that. We also outlined some what we call foundational skills of a technical working group. Not only the skills, but the characteristics of a technical working group that would make a technical working group a meaningful space for all the partners, and a set of core actions that we normally would expect that any technical working group would be following or would be having in their different capacities. When it comes to common coordination structures, it's important to emphasize few aspects. First, terminology. Technical working group we have adopted in the handbook this term technical working group, but this is not written in stones. There are different models that can, in different places, the coordination structures can be called, like task force, like coordination group, or technical working group. The idea is that we were careful with terminology because we know that terminology might terminology shapes reality and also can reinforce the characteristics of a group. For example, co-chairs. We use the terminology co-chairs, but co-chairs, essentially, they are not coordinators in a way that they decide the direction or they make decisions. The co-chairs of technical working groups are normally facilitators. So they are actually the agencies or the organizations co-facilitating the collaboration of that space across the different partners. And so we also don't make co-chairs as the only name. Can be facilitators, can be, so there are several examples there in the handbook of a way that this role can be called. More important than the name of the terminology of those roles, it's the characteristic of the roles, which some are exactly this aspect of collaboration as a driver for good coordination results. And that is coming from several experiences or learnings and models of leadership. And we believe that this is one important point. First of all, because though being part of coordination mechanisms is a good practice, not everyone is obliged to participate in those spaces. So that's why we are kind of trying to offer a configuration of such a group that can be quite conducive for everyone. The handbooks is required to be contextualized, and there is a strong language on localization of coordination structures, meaning local actors at the lead of those processes, not international actors. And there are a few examples of how that can work. So this is on your left, the left of the screen, you can see how that works in humanitarian emergencies where you have the cluster activation. So MHPSS is not one more sector, but it's a topic, it's a thematic presence across the different sectors. So education, health, protections, they have representation of MHPSS representatives. So this is just to show one possible structure of organizing it in the different contexts. Trying to respond to the following question: who should be part of the technical working group? And who should lead the technical working group? So first of all, the leadership of technical working group is not protection, it's not education, it's not health, but it's the three of them, because they matter in different capacity for the three of them. Who should be part of this technical working group? Only health actors like psychiatrists, psychologists, or protection actors such as social workers, community leaders, or educational actors such as pedagogical staff, teachers. All of them should be part of a technical working group as it is suggested and offered by the IASC guidelines. We describe as well, we try to describe again, roles and skills and a way of building consensus. So technical working groups is not about, again, a top-down decisions, but it's building consensus. And there we give some suggestions of that. Plus sharing some what we call key skills and characteristics of technical working groups that facilitates the work of the technical working groups. And then I come to the, I would say, the technical part. So the way that I myself personally like to describe the handbook is that the handbook is divided in two main parts. One part is about governance, which is actually everything I have explained so far. So governance in a way of explaining what constitutes technical working group, the leadership of technical working group, the purpose, etc. And the second part is what I call the technical part of technical working groups, which is called the core actions. The core actions of the technical working group are those 7 aspects. One is about, the first one is about having the technical working group, so having a space for coordination. In many contexts can be about creating it because it doesn't exist. In other contexts can be about reactivating the technical working group, or in other contexts can be about shaping the structure that is there already in place and make sure that this reflects the principles of this work in terms of multi-sectoral principles, etc. A second core action is information management, which I will come back to that shortly. The third one is about establishing links with different stakeholders internally and externally. It's a place where it's expected to help build the capacity and be a place for knowledge exchange and mutual support. It is, technical working groups is expected to support monitoring and evaluation mechanisms. It is the responsibility of the technical working groups to think about the long-term sustainability, which is the core action 7. And one of the essential aspects of the technical working groups is exactly on advocacy and awareness raising. From all those 7 elements that is there on the MHPSS coordination handbook, again, it's Marcio, it's personal. The emphasis that I normally give is that if ever things go bad, all the 7, all the types of activities on technical working groups not going so well, if there is one that is really expected and important to work well, is the number 2, is really to have a good information management system. An information management system is not only about accessing data, accessing information, but is transforming that information in operational work. So it's not only about 4 Ws, knowing who is what, where, and doing what, not the traditional 4 Ws. But what do we do with this information of the 4 Ws? It is the core action that we expect a common sense of assessment or formal assessments to be conducted. Analysis of gaps and understand about the response in a comprehensive manner. So it's that well described, this function in particular, the information management. And in my personal experience, one of the things when I'm part of technical working groups in different emergencies and in different capacities as well, if there is one thing that's really going to help everyone on the ground a lot, is having a good information management system established for mental health and psychosocial support response. That is one core aspect that should be stressed about, but it's not the only one important. All of them, they are there, and they are expected to be part of a technical working group, work plan, or agenda. My dear colleagues, this is an entire course. I'm not going to go for each of those core activities, but what I can tell you to conclude this part is that in terms of what the handbook is and it's not. The handbook is not something to be prescriptive, ruling out on how technical working groups should work, should be established, should be named, to define their work plan. Again, it's a global tool. It's a global tool endorsed by the Interagency Standing Committee. That's why it's IASC. IASC is the highest level of the humanitarian coordination mechanism in the United Nations system that gives this endorsement, meaning this endorsement means that this is a tool that is a collective resource. This is a collective resource. So this is not WHO, this is not UNICEF, this is not IFRC, Red Cross. No, this is a document that represents a collective effort. So it belongs to the humanitarian sector as such, in all actors, which is one of the reasons of why it took so long to get it approved, because to have it endorsed by the Interagency Standing Committee takes a long approval process, consultation process, and every consultation comes back with some questions and revision, which makes it a long process to be approved. But once it's endorsed, it kind of becomes a reference or a guiding document in the field. Takes this document as a guide that you can look at this handbook and perhaps get insights from this handbook to your particular context, your own context, and see what applies, what doesn't apply, or what are the things that you think that you do that's not represented in the handbook, and it can even become a feedback as well. So I conclude here this part, and we're going to come back on that in 2 moments. Today, we're going to, of course, we are happy to take questions and reflections and comments in terms of how that can apply to the context, especially for the Caribbean context. And the second point, it will come later. We are engaging to think about a formal rollout, training rollout of this handbook in the region, but that we will come back later on. Thank you very much. And now I give you back, Michelle, for the next parts.
Okay, Matthew, thank you very much for that. Such a comprehensive description of the handbook. And for me, listening as a practitioner, as someone in the field, I think I could say, and I think I could safely say for everyone, that when in whatever field you are, when there are guidelines, when there are structures that help to just describe what happens in the space, it makes the work so much easier. And so thank you for taking the time to describe in very clear terms what the handbook allows for. You gave the why, why it came about, the focus of the world on MHPSS. The MHPSS has come from the shadows right into the forefront, and that is so very important. So you talked to us about the why, the lengthy process, and of course with that comes making sure that the process, the handbook is one that has value, has integrity, and is able to serve the populations. You talked to us about the who, and you talked to us about the what. And the what gives us, as I started by saying, an outline, a direction for where we are going. So you gave us that great overview. You were able to look at some of the core actions of the MHPSS coordination, and you focused on the one that you felt was most important. Of course, recognizing that other people may feel differently about what is important to them. But you certainly guided the discussion to a point where it gives us food for thought. And again, we want to encourage people to take in what we are saying here today and to use the time to chew on some of the things that have come from today's session. And hopefully it would, increase your curiosity so much so that you could be a further part of this engagement that we have, the MHPSS committee. So I am going to ask Alicia now to spend some time with us on some conversations, because we're here talking about some of the framework, the book, and all this kind of stuff. We want to know how it's going to fit, where it's going to fit, what is the context in which that is going to happen. And so we're going to have Alicia carry us through some conversations about MHPSS coordination and the way forward in the region. And I noticed that we have people from outside the region, and we welcome that because, of course, MHPSS is a global issue, a global concern, and a global reality. And so while we're talking about Caribbean realities here, we are talking about global needs. And so, Alicia, we're going to ask you to take this discussion forward.
Alicia, you're muted.
Sorry, good afternoon, everybody. We're going to look at our way forward, the way forward for our committee of practice. Our committee of practice is led by us. It's a community, and it depends on our participation to move this community of practice forward. The way we can help is by joining our meetings, which takes place every 6 weeks on a Wednesday. So every 6 weeks on a Wednesday we meet, and you are free to join us, register to join us. Our next meeting will be March the 22nd, and then we'll be discussing climate change and MHPSS in the Caribbean. Our next meeting in May the 3rd, we will have an open discussion about decolonization and MHPSS in the Caribbean. In June 14th, we're going to talk about culturally sensitive approaches and MHPSS in the Caribbean. In July, we're going to talk about knowledge and experience exchange in MHPSS. We'll have a discussion. In August, the 30th of August, we talk about topics related to the hurricane season. In October, we're planning a webinar for Mental Health Day. And November, we're looking at MHPSS in the Caribbean. Where are we at? Okay. So these are some of the topics we have for this year. Our community of practice, we have a space at MHPSS.net where resources are available. So you can click onto MHPSS.net and look for Caribbean region MHPSS, where you can click and join, so you can get the resources there. We are seeking your support. Persons can join in our meeting planning. They can join with our meeting planning, the newsletter, assisting in the management of the community of practice. All of this will be available. You can tick in your exit survey. You can tick what you're interested in, and we'll get back in touch with you. We have been meeting virtually over the past 2 years. And one of our plans for this year is to meet in persons. So we'll be looking out for that and for your input. Okay, so these are some of the things we have on our way forward for our MHPSS community of practice. Right now, I'll hand you over to Valeria, and she'll give you an update on our newsletter. Thank you.
Hi, everyone. My name is Valeria, and just a brief description of the newsletter of the Caribbean region MHPSS COP. So this is a new feature that they will have, and we're going to share the past meeting recordings like this one, also the next meeting dates with the registration link, and any other upcoming events related to the Caribbean region and MHPSS. You will also find there resources and any other information that could be useful. We're going to share on the chat the link for you to register to the newsletter.
Back to you, Michelle.
Okay, thank you, Alicia and Valeria for that. So Alicia, when you were talking, you were talking a little bit about the Caribbean region. And basically you said we need to move this forward. Again, we talked about the Caribbean. We see people from all over the world here, but we're looking at the Caribbean region. And so you're saying we need to move this forward. How do we move this forward? We have as many people as possible who are working in mental health and psychosocial support in any form to join us. We feel that the more people that have a voice, the more people that add to the discussions, the richer of an understanding we have about how MHPSS could roll out in the Caribbean region. You'll notice from the list that Alicia went through in terms of the sessions that are coming up, the rich diversity of discussions coming up. So we have discussions about climate change. We have discussions about culturally sensitive approaches. We have discussions about hurricane season. We have discussions about World Mental Health Day. The point is that mental health and psychosocial support doesn't only just connect to disasters like hurricanes. We see hurricane season there, disasters like hurricanes. Mental health and psychosocial support is a part of or it manifests in culture. How do you approach or how do you respond to things in a culturally sensitive way? Climate change and the impact. So we're talking about hurricanes and so forth, and we recognize the direct link between climate change and hurricanes. But climate change could also speak to how people live in villages and fish in villages, and what happens when their livelihood is impacted by climate change. The point that I'm making is the discussions about MHPSS and the impact are wide and are vast, and you would see in our description of upcoming events that we will touch on various different things. So thank you very much. And then Valeria, of course, put in the chat the link that you could follow to join us. And remember when I started, I asked for people to look at the links and look and see what we have upcoming and how you could be a part of the MHPSS. So that is important. So I don't know if there are any questions that need to be answered here. I see there is a hand raised, Marcio.
Thank you so much, Michelle. I think we can actually now remove the slide, and so everyone can see each other better.
Yes.
And we have some 10 minutes maybe for open dialogue of whoever wants to make any comment or intervention. I just want to, I got inspired about what you said, Michelle. You have such a nice way of phrasing things. And I was just reflecting here in the meantime that I think we are at the moment really rethinking mental health around the world. I think there is more and more understanding that the whole of society kind of approach to mental health, you know? Which is, I think it's brilliant, especially in this side of the world. When I say this side, is the America continent, South America, Central America, Caribbean region. This important awareness that mental health is not only for specialists, is not only the responsibility of psychologists and psychiatrists. More and more, we are kind of really getting this awareness that this is for all of us. It's our responsibility. And I think the best examples I have in my entire career working in MHPSS in emergency settings are actually the ones that are community-led. No? So, and that's why I think going to this direction of building a community of practice is exactly, it means that it's not organizations-led. No? I mean, it is about stakeholders' participation. But what makes it a meaningful process is when there is the face of it is a collective face, and instead of flagships. So that's, I think, something we have been on a pace that is proper from this group of building, and this is the ethos that I think it has been putting us together. And a unique contribution, I must say, where it's going to this direction, because communities leading the work of MHPSS means also a community that is resilient, that builds towards resilience. And I think a bit of this is exactly what we are having and trying to facilitate through this process. So I just want to say those words and then open here for the whole group, whoever wants to send comment, you can write or can open your microphone as well. I'll just ask you to introduce yourself when you make the comment.
Okay, so this is the point. We have a few minutes where if anyone wants to address anything that is burning for them right now, anything that resonates, anything that we could clear up in this forum right now, I think you have the ideal time to be able to ask that question while you have all of us here, including Marcio, who's right here and able to answer your questions immediately. If people don't have any questions right now, I know sometimes it takes a while to process everything that you've heard and been a part of, and then you could come back to it. So we have somebody, Holly. Holly has a raised hand. Hi, Holly.
Oh, there.
Yeah.
Thank you. So I'm Holly Campbell-Rosen. I work at the National Institute of Mental Health, part of the National Institutes of Health in the US. And I'm here to basically learn from you because the side I work on is research as it relates to humanitarian settings. And in that setting, we have people who study how to train and build competencies around non-specialist or community health workers. And I was wondering, Mauricio, if you meant, when you talked about capacity building earlier, did you mean it in that sense, or did you mean it in among the community of practice, or both? I'm just curious how you integrate that into your work. Thank you.
Thank you, Holly, for your question. I mean, from my side, if I can direction I would have is that I think one dimension is really going towards this kind of mindset or mind frame of offering to the entire society this understanding or this realization that mental health is for all, and I am also responsible for the well-being of my community, of my population. So we kind of reduce that perspective of the only person responsible for that is the professional hat, and I think this has been, especially coming from the humanitarian perspective, this has been a framework that we have been more and more realizing of how the contribution of that. So that has been one dimension of inviting the community to have to be at the driver's seat of this whole initiative. So this is one part. When it comes to capacity building, so that capacity building, it goes back as well to that framework we also have on the different layers of the pyramid, where we have different actors with different responsibilities and equipping them with different skills given their own responsibility in this whole framework of mental health and sexual support, either by preventing mechanisms or responding to the crisis situations. No? I think I have a very good story to kind of perhaps try to describe a bit what I'm saying as well. Is during the COVID times, I was in a country not here in our region, and I saw the following promotion of a professional association, a mental health professional association. The promotion was the following: are you suffering? No, that was the statement. And then the answer was, go and look for a psychologist. So that for me was kind of an absurd because and I think everyone here will agree that like you're promoting, if you are suffering, if you are sad, if you are feeling, well, go and talk to your friends, go and talk to your family, go and talk to people that are empower the community to realize that they are also drivers of well-being, of mutual support, the peer-to-peer support, so many things that we have been advocating for. And that doesn't mean that we reduce the role of a mental health professional. No, we actually we kind of also put it back perhaps to what. So it's what we have been also in many contexts. And I don't know if everyone is familiarized with the pyramid of services, of mental health services, no? Where the fourth layer is the mental health specialized services. Normally, what we see in many contexts is the inversion of that pyramid. The entry point for services is exactly the specialist. And that's what I think we have been trying to come to a moment. And that's why I think we are at the moment of change in that sense, where we invite the whole community to integrate that mindset, and followed by several steps.
Thank you very much.
All right, thank you. Thank you for that question, Holly, and thank you, Matthew, for giving such a detailed explanation of how MHPSS just plays out and how it's important to us in our day-to-day lives. Are there any other questions that we could field while we're here waiting? So if there are none others, if there are no other questions, again, feel free to put them in the chat if you want to, and we do have a few more minutes, but if there are no other questions, remember that I indicated that we are open for you to email us your questions. And I think Valeria would have put in the chat any relevant ways to contact the MHPSS team. All right, so I think this is the time for us. If there are no other questions, I think this is the time for us to say our goodbyes and our thank yous. I think we did a great job in just wrapping this up nicely in the hour that we identified. And so I want to thank everybody for coming. You would see in the chat that Valeria is reminding you to please do a couple of things. The exit survey, that would be so important for us to be able to have some information to help us as we go forward. In the chat, of course, would be a link as to how you can be a part of any aspect or any activity in this MHPSS grouping. I think she put in the chat too, the link, it would be a link how you could join our our meetings every 6 weeks. And there's a registration to get the newsletter. So there's some things in the chat that we want you to pay attention to. It's very important for us. I just want to say thank you to a few people. Of course, the persons who are leading or who led this afternoon's session. So we have Valeria and Anna who are doing the technical stuff and making sure people were admitted into the room, and the chats, monitoring the chats and answering and making sure questions, making sure the links are there, making sure questions are directed to where they need to go. So thank you very much for that. To the presenters, to Zita, who started off by giving an overview of the community of practice, MHPSS, and how it started. And I think that was an important thing for us to start with, because we have a context, and that context indicated chronology and a line. So we see how we built from one thing to the other. And so Zita, thank you for being able to put that context here for us this afternoon, so we could see how we started and where we're at now. And then of course, Marcio, thank you very much for, I don't want to use the word simplifying, but that's what you did. You simplified what the handbook is about and what it does. And as I said, a handbook is for us in any field, a roadmap, a guideline to what we're doing. And so you were able to highlight some of the things that came out of the handbook. And so thank you very much for that. I think you whetted our appetites so that we could, search further, see what it's about and see how it could help us. And then Alicia and Valeria, you were able to talk to us about next steps. And that's always important, because when people are invited to join something, they do want to know what's coming next. So you got a little bit of a whetting of the appetite as to next steps and how we see ourselves operating in the next few months. We would love to have people join us on these virtual journeys that we have. Again, you got some information about the topics that are upcoming, and I'm sure they're relevant to you in the very various fields that you're working in. So please feel free to join us. And just in closing, I want to say that there's some things that came up in all of the discussions that seem to be thematic, seem to be recurring. So we heard about MHPSS being all of us. And so we're moving away from this notion that mental health and psychosocial support belongs to mental health professionals only. And we recognize that it belongs to helping professionals who are able to provide a wide variety of services to people, from simply providing information to providing connections to providing resources. The scope of MHPSS is broad, And I think that came across in all of the discussions today. The word resilience came out, and that is what we are trying to promote when we talk about MHPSS. We want communities and people and individuals to tap into their resilience. And that is what we as workers do. We help people tap into their resilience, because there's no way we could psychologize people out of situations that they may come in. We want to tap into their resilience. And so that came out in various forms in the discussions. We recognize structure and the need to have structure. So even though we're talking about all of us as professionals working and responding in different ways, we have to respond in a structure. And so that came out, and it was part of what Marcio talked about in the book. We have structure. Again, what came out is that this is a community of professionals, and a community of professionals simply means that we have people from various different backgrounds doing various different things, providing support, and that is the community. And so these are the things that came out here this afternoon. I mean, you know, we just spent an hour, and, you know, as I'm listening to Marcio, and I'm listening to other people, and I'm listening to the issues that came out, you recognize that we could spend a half a day talking about MHPSS and just sit comfortably in talking about that. So we spent an hour. We thank you. We thank you for giving us an hour of your time. We thank you for listening. We hope that that listening then translates into you joining us on this journey as we take MHPSS to another level. So thank you very much. Again, please remember to follow the links and to respond to the links as needed. And we hope to see you again when we have our March meeting. And again, thanks very much, everyone, and have a great afternoon.